All right, let's kick off another deep dive. Today, it's all about those tiny teeth. You know, kids' dental care.
Kids dental.
You guys sent in some awesome excerpts, by the way, from this Dental Care Basics for Children thing.
Yeah.
Really focusing on, like, the ages between 5 and 13.
Mm-hmm.
And let me tell you, just skimming through it, I'm already like, whoa, did not know that. So our mission today is to basically walk away feeling like, okay, we got this. We can help our kids get those healthy smiles for life.
Definitely. Yeah.
And speaking of early years, like, I was reading this fact that just blew my mind.
Okay.
It turns out baby teeth, those little guys, are actually more prone to cavities than adult teeth.
Right.
And I always thought it was the opposite. Like, they're so small, how much damage can they really do?
Yeah, I think most people think that, but remember how easily those baby teeth used to chip? Like biting into an apple could practically take one out. And that's because the enamel, that outer layer, it's much thinner and more delicate in baby teeth. So, it's like comparing a porcelain teacup to a sturdy coffee mug. They're just much more susceptible to those acids that are produced by the bacteria, which is the main culprit behind those cavities.
Ah, okay. So it's like those tiny teeth are working overtime just to keep up.
Right.
And I guess that's why this whole guide, it really emphasizes that transition period when kids have both baby and permanent teeth happening at the same time.
Right.
We call it the mixed dentition phase, which sounds way more complicated than it needs to be, honestly.
Well, it is a pretty dynamic time in there. You got teeth coming in, teeth falling out.
It's a whole production.
It is. It's a whole production. And that's why we need to pay extra attention during those years, because those newly erupted permanent teeth, they're vulnerable, and we want to set them up for success right from the start.
Absolutely.
Yeah.
Speaking of those permanent teeth coming in, I always just assumed, like, the baby teeth just fell out randomly. But this guide actually mentions there's an order to it.
There is.
It's like a choreographed.
It's true, yeah. It usually starts with those central incisors, those front teeth.
Okay.
And then it's followed by the lateral incisors on either side.
Right.
And then the first molars make their appearance, followed by the canines, and then the second molars. So
it's not just chaos.
No.
No, the method to the madness.
There is. It's a well-timed process, and it usually spans from around age 6 to 12.
Okay, so knowing this timeline can help us, like, anticipate when to expect those gaps in those brand new pearly white.
Exactly. And of course, we can't forget about those late bloomers.
Oh, yeah.
Wisdom teeth.
Those guys.
Yeah, those usually show up much later, between 17 and 25.
Oh, wow. Okay.
And they often need a little extra help.
Like an addiction notice.
Sometimes.
Because I remember mine were not welcome guests.
Right. Well, it's true. They often cause problems simply because there's just not enough room for them.
Yeah.
And they can become impacted, meaning they get stuck and they can't erupt properly. And that can lead to pain, infections, or even damage to the surrounding teeth. So it's often recommended to have them removed, before things get messy.
Yeah, it's like trying to squeeze one more person into an already packed elevator.
Right.
Someone's got to go.
Someone's got to go.
But okay, enough biology lessons for now. I mean, this guide lays out some really practical tips for keeping those smiles healthy, both baby and permanent.
Absolutely.
And I'm guessing like a lot of these will sound familiar to people, but
yeah,
it's always good to have a refresher, right?
Always good.
So hit me with tip number 1. What's the foundation of a healthy smile?
Brushing.
Okay.
Twice a day.
Of course.
Every day with fluoride toothpaste.
Fluoride?
Yeah, fluoride is like a superhero for teeth. It strengthens the enamel, making it more resistant to those cavity-causing acids.
And I'm guessing we need a specific type of toothbrush to apply that shield.
You do.
Because not all toothbrushes are created equal?
Right. A soft-bristled toothbrush is key, especially for kids. Because those hard bristles might seem like they're doing a better job, but they can actually damage the gums and the enamel. You want to be gentle, not aggressive when it comes to brushing.
Okay, soft bristles it is. What about flossing? I'll admit, that's the one I tend to skip sometimes.
Right.
But this guide stresses like it's non-negotiable.
It is, and you're not alone. A lot of people skip it.
Yeah.
It can feel like a chore, but it's so important for removing plaque and food particles from between the teeth. Those hard-to-reach spots where your toothbrush just can't quite get to.
Right.
Think of it as like a deep clean for your teeth.
I like that, a deep clean.
Yeah.
Okay, so flossing is crucial. What other daily habits should we be focusing on?
Mouthwash. Rinsing with mouthwash once a day can help kill those lingering bacteria and freshen breath, which especially as kids get older, that fresh breath can be a real confidence booster.
Definitely. And I'm sensing a theme here. It's all about creating a hostile environment for those pesky bacteria.
That's right.
So what else can we do to keep them at bay?
This one is surprisingly simple. Drinking fluoridated tap water.
Oh, okay.
Yeah, it's like a continuous fluoride treatment throughout the day, giving those teeth an extra boost of protection.
So easy. And last but not least, the one we all know but might dread.
Regular dentist visits.
There it is.
Yeah, at least twice a year for checkups, cleanings, and professional fluoride treatments.
Right.
Yeah, and a dentist can spot those potential problems early on and provide personalized advice for your child's, specific needs.
Okay.
So think of them as like your partner in crime when it comes to your child's oral health.
Partners in crime, fancy cavities. I love it.
Yeah.
Okay, so those are like the core practices, but this guide also dives into some specific dental issues that kids often face.
Right.
And it makes sense. Their teeth are still developing, so they're going through a lot of changes.
Okay. They are, and one of the biggest challenges we see in young children is early childhood caries, or ECC.
ECC?
This is a severe form of tooth decay that can actually start as early as infancy.
Oh, wow, infancy.
Yeah.
So it's not just about like those baby teeth popping up. It's about protecting those gums even before the teeth arrive.
Exactly. It's never too early to start thinking about oral health.
Right.
And with ECC, you'll often see these white spots on the chewing surfaces of the molars.
Okay.
And if left untreated, those white spots can turn brown or even black, and the decay can spread quickly.
I remember seeing those spots on my nephew's teeth.
Yeah.
It was kind of scary how fast they seemed to appear.
It can happen quickly.
So what causes those spots to form in the first place?
There are a few culprits. Frequent snacking on sugary foods and drinks,
Okay.
prolonged bottle feeding,
Right.
poor oral hygiene, and even certain medications can increase the risk.
Mm-hmm.
And here's the kicker, even though we know baby teeth eventually fall out, neglecting those cavities can have long-term consequences.
So it's not just a matter of, oh, they'll get new teeth anyway.
Right.
Those early cavities can actually impact their permanent teeth.
Unfortunately, yes, the bacteria responsible for those cavities can linger in the mouth even after the baby tooth falls out.
Oh, no.
And those bacteria can then attack the newly erupted permanent teeth,
Oh, wow.
making them much more susceptible to decay as well.
So it's like setting them up for a lifetime of dental problems.
It can be, yeah. It's definitely a reason to take those baby teeth seriously.
Okay, well, that's a pretty convincing argument.
Yeah.
So let's say a cavity does form. What are our options? This guide mentions a few treatment options, thankfully.
Thankfully, yes.
So what's the most common approach?
Dental fillings are usually the first line of defense.
Okay.
And the good news is dentistry has come a long way.
Mm-hmm.
These procedures are much more comfortable and minimally invasive than they used to be, especially for kids.
That's reassuring.
Yeah.
So walk us through those fillings. Like, what are they made of? What are the different types?
Sure. Well, there are a few different materials used for fillings. Composite resin is a popular choice because it's tooth-colored,
Okay.
so it blends in seamlessly.
Right.
Amalgam or silver fillings are very durable, but they're more noticeable.
Mm-hmm.
And then there's glass ionomer, which releases fluoride, providing an extra layer of protection.
Okay, it's like choosing your weapon against those cavities. So which material is used kind of depends on the size and location of the cavity, I'm guessing.
Exactly. And sometimes a filling isn't enough. If the decay is more expensive, we might need to consider a dental crown.
Ah, yes, the crown fit for a tiny tooth. But seriously, what exactly are those?
Dental crowns are like little caps that fit over the entire tooth,
Right.
providing that extra strength and protection. And for baby teeth, we often use stainless steel crowns because they're super durable and can withstand all that wear and tear from chewing.
So it's like giving that tooth its own little helmet.
Maybe not a helmet, but you get the idea.
Yeah.
And for permanent teeth, there are, more aesthetically pleasing options like porcelain fused to metal gold alloys or ceramic crowns.
Okay.
And those are designed to blend in with the natural teeth. So
Right.
they're less noticeable.
Gotcha.
Yeah.
And then, of course, there's the option we all dread, extraction. I'm assuming that's a last resort.
In most cases, yes.
Okay.
Extractions are usually only necessary if the tooth is severely decayed or damaged beyond repair.
Mm-hmm.
Sometimes a tooth might need to be extracted due to overcrowding, but we try to avoid that whenever possible.
And this is where it gets interesting because the guide mentions something called space maintainers.
Yes.
And I have to admit, I'm not really sure what those are or why they're important.
Well, space maintainers are actually pretty cool. They're custom-made appliances that we use to hold the space open when a baby tooth is lost prematurely, usually due to decay or injury.
Okay, so why is it so important to hold that space open? Won't the permanent tooth just come in and take its place eventually?
Well, that's what we want to happen, but without a space maintainer, the surrounding teeth can start to drift into that empty space,
Oh.
and then when the permanent tooth is ready to erupt, there's no room for it.
So it's like saving a parking spot.
Exactly. And if we don't reserve that space, that permanent tooth might erupt in the wrong spot, leading to crooked teeth, crowding, and even bite problems.
So those space maintainers are actually preventing a whole lot of trouble down the line.
They're like a little investment in your child's future smile.
I like that.
Yeah, they help ensure those permanent teeth come in straight and strong.
That makes so much sense. It's not just about fixing the immediate problem.
Right.
It's about thinking ahead
It is.
and preventing future issues.
Precisely. And speaking of thinking ahead, this guide also touches on the importance of making those daily routines like less of a battle and more about building those positive associations with oral health.
Yeah, because let's be honest, like, no parent enjoys those nightly toothbrushing battles.
Right. It's all about finding what works for your child and their personality.
Exactly.
Some kids respond well to like those colorful toothbrushes or fun flavors of toothpaste.
Oh, yeah?
Others might need a little extra motivation, like a reward chart for consistent brushing and flossing.
I love that idea. It's amazing what, like, a few stickers can accomplish.
It's true.
And maybe even, like, let them pick out their own toothpaste flavor at the store.
Oh,
Make
yeah.
them feel like they have some say in the process.
Ownership is key. And of
Yeah.
course, the most powerful tool we have is leading by example.
Mm.
If kids see their parents prioritizing their own oral health, they're much more likely to follow suit.
That's so true.
It's that whole like do as I do, not just as I say approach.
Yeah, preach. So, to our listener, consider this a challenge. Get creative. Think outside the box when it comes to making dental hygiene fun and engaging for your kids. Because those healthy habits, they start early.
They do.
And a healthy smile is a gift that lasts a lifetime.
Well said. And remember, you don't have to go it alone. Your dentist is a valuable resource and can offer, personalized guidance for your child's specific needs.
That's a good point.
They've seen it all, and they can offer like tips and tricks for making those dental visits less stressful and even enjoyable.
Such great advice. And on that note, I think we'll wrap up this deep dive into kids' dental health.
Okay.
Hopefully you're walking away with, like, a toolkit full of knowledge.
Definitely.
And a renewed sense of, well, let's say enthusiasm for those tiny teeth.
For sure. And remember, a little effort now can save a lot of headaches and toothaches later on.
Couldn't have said it better myself. Until next time, happy brushing, everyone.
And may those pearly whites sparkle for years to come. It's been great talking all things kids' dental health.
Yeah, this has been really eye-opening, actually.
Glad to hear it.
I feel like, as a parent, we tend to focus so much on those big milestones, like walking and talking.
Mm-hmm.
But taking care of those tiny teeth, it's just as crucial. And I love how this guide really emphasizes that it's never too early to start.
Right from the beginning.
Yeah, like from infancy, we're already setting the stage for a lifetime of healthy smiles.
Exactly. And those early habits, they really make a difference.
So true. So to all the parents out there, listen, you've got this.
You do.
Arm yourself with knowledge, make it fun, and remember, your dentist is your ally in this whole journey.
Couldn't have said it better myself.
All right, that's a wrap for this deep dive.
Until next time.
Take care, everyone.